Welcome back. It's time for a posture check as we get healthy on a Thursday. We're going to learn some exercises to help improve your stance in a few minutes. But first, we want to find out how posture really affects your overall health. Dr. Jocelyn Kernack is joining us from her practice, Active Life Chiropractic. Good morning to you, doctor. Afternoon, I should say. How are you?
Good morning.
Hey,
I'm doing great. How are you?
I'm good, but I worry about this posture thing, and I'm wondering about overall, what kind of things can happen if you have bad posture?
So I have a wonderful poster here that kind of demonstrates that. And there's a whole list of common things that people don't realize the forward head posture can contribute to, such as headaches, neck pain. It can strain your jaw joint. It can tighten the muscles at the base of the skull and then crimp off the nerves that go to your skull and cause headaches. It will contribute to rotator cuff tendinitis because of the mechanical disadvantage you put the shoulder in. And so my typical new patient, one of the first things we'll do is I'll have them stand sideways and we'll go over where their head is in relation to their body. So I have a patient here, Christine, and I'm looking at the side view, and the first thing I'll look at is where's the middle of their ear in relation to the middle of their shoulder joint. And typically it's a bit too far forward. And what I explain to them is just 1 inch of being too far forward can double the strain on all the traps, the base of the skull, and their entire spine. It can also even decrease their oxygen flow from the diaphragm because it crimps it off.
Wow, that is a lot
we'll
that can be caused by
them.
just simple poor posture. And I know that there's a way that you can kind of put yourself against a wall and get an idea of what your posture is like.
Exactly. I like to give simple things that patients can do so everyone's got a wall. So Christine, can you just stand with your heels against the wall and then try to lightly touch the wall with the back of your head. Now to most patients this is going to feel really strange because they're used to having the other pattern with the head forward, but this wall gives them a guide to how they should feel. So I'll have them stand there for about 30 seconds a day. We call it the wall stand. And then very slowly walk away and try to maintain that and still be able to breathe. Oh. And as they do that, at first it'll feel really strange. And they will actually feel taller. They'll feel more energy coming out of their spine. They'll take a lot of strain off. And it really feels different than when you're hunched forward, even emotionally.
Wow, that is a simple check. So you want to maintain that wall stance for your normal posture?
It's just a guide because most people can't feel when they're doing the wrong posture. They're so used to slumping forward that feels normal to them. So the wall just gives them a guide at home. They can also, if they have a smartphone, give it to a friend or a colleague at work and have them, when they're sitting at their chair, just snap a quick side view picture of them. And then they have that to look at, and they usually say, oh my gosh, I didn't realize how forward my head was all throughout the day. And that's a lot of repetitive stress on their entire spine.
Well,
so
Christine,
that gives a visual aid, which makes it a little bit easier.
Christine is looking lovely there. Is there anything else you can do, like look in the mirror and see if you're out of alignment?
Sure. Well, and also with new patients, I will look at them first of all, and Christine, if you want to stand facing that way, and we'll try to point out to them things they may not be aware of, like if they have a slightly higher shoulder on one side, if the head is tilted, if there's a high hip joint. And again, often they've been doing that for years and don't realize it. So I'll have them stand and go over to a mirror. If you want to walk this way, Christine, I think we've got a friendly mirror in the corner there. And
dealing in a small
face
space
the mirror
there,
and we'll point that out to them. Yes, I keep that mirror there for many reasons. And they'll see if there's a high shoulder. And often they had no idea. So I will work to realign them. I'll work on the muscles. We'll work on the bones and joints. And then if they work on their posture, they can help maintain that a lot longer.
Very good. Now, Dr. Kernack, when you do identify a problem and, help a patient like Christine, how long can it take to correct the posture?
So it depends partly on the age and the motivation. The younger a person is, of course, they haven't been doing it for as many years. So it's easier to break that pattern. If they're older, if they're motivated, they certainly can do it. It may take a few months. And every day I tell them, just take a finger, push your chin back, say, where's my head throughout the day? And eventually those muscles will strengthen. It'll feel more normal. But the person has to be motivated and also realize it won't happen overnight. Just because I'm standing up straight and I'm telling them you got to stand up straight, they won't suddenly be able to do that, because certain muscles have gotten a little weak and certain muscles have gotten really too activated, like the muscles that do this.
Absolutely.
So we've got to reduce that imbalance and make this the new norm.
All right. Well, Dr. Jocelyn Kernack, really good information for us this afternoon. And thank Christine for being such a wonderful model and patient there. We appreciate it.